This is not old age, the Librela neurological crisis no one is talking about. What we are seeing in a growing number of dogs treated with Librela is not simple aging, coincidence, or pre-existing disease being unmasked. It is a pattern that aligns disturbingly well with the known biological role of nerve growth factor, NGF, and what happens when it is chronically neutralized. Librela works by binding to NGF and preventing it from activating its receptor TRKA. While this mechanism reduces pain signaling, NGF is not a single-purpose molecule. It is a fundamental neurotrophin required for the survival, maintenance, and communication of multiple neural systems throughout the body. When NGF signaling is persistently blocked, the nervous system does not simply turn down pain. It begins to lose structural and functional integrity. Dogs reported after Librela treatment have shown urinary and fecal incontinence, progressive weakness, ataxia, proprioceptive loss, muscle wasting, behavioral flattening, and cognitive changes. These signs form a coherent neurological syndrome rather than isolated adverse effects. Recent peer-reviewed work by Farrell et al. 2025 presents clinical and temporal evidence consistent with the progressive neurodegenerative process temporally associated with chronic NGF inhibition. The phenotype described lower motor neuron dysfunction, autonomic instability, sphincter dysfunction, sensory disintegration, and secondary musculoskeletal collapse is exactly what would be expected when trachea-dependent neurons lose trophic support. The problem is not simply what the drug does. It is how it was approved. The pivotal trials used to authorize Librela were structurally and capable of detecting delayed or cumulative neurotoxicity. They were short-term, excluded neurologically vulnerable or geriatric animals, and lacked meaningful neurological endpoints. There was no longitudinal neuroimaging, no neurophysiological testing, and no biomarkers of neurodegeneration, such as neurofilament light chain or glial markers. In short, the studies were designed to prove efficacy while being blind to long-term neurological harm. Post-marketing surveillance has relied on passive reporting, placing the burden of detection on veterinarians and grieving owners rather than active signal monitoring. This approach historically fails to capture low-frequency but high-severity adverse outcomes, especially those that develop gradually. The emerging syndrome seen after widespread clinical use closely parallels what occurred in human NGF inhibitor trials, where similar compounds were ultimately halted due to rapidly progressive joint destruction and neurological harm. This is not speculation. It is a predictable biological consequence. NGF is not merely a peripheral pain mediator. It is essential for sensory neurons, autonomic regulation, and central cholinergic pathways. Chronic blockade disrupts proprioceptive feedback loops, impairs retrograde axonal transport, destabilizes neuronal cytoskeletons, and initiates distal axonopathy. The resulting muscle atrophy, joint instability, and mobility collapse are not separate orthopedic diseases. They are the mechanical expression of nervous system failure. Continuing widespread use of Librela without neurological risk stratification, baseline functional assessment, serial monitoring, and independent long-term safety data is scientifically indefensible. This is not an idiosyncratic side effect profile. It is the systemic collapse of trophic, signaling homeostasis, induced by the drug's core mechanism of action. Silence at this stage is not neutral. It is complicity. Veterinary medicine must now confront whether ongoing endorsement of this molecule reflects evidence-based care, institutional inertia in the face of mounting biological implausibility, and patient harm